When my father turned 72, I remember him proudly showing me a folder of test results. He said, "Look, I've done every scan, every checkup they told me to. I must be safe now." But a few months later, one of those very tests led him into weeks of anxiety, unnecessary medication, and side effects that made him feel worse than before. And he wasn't alone. Every year, millions of older adults walk into clinics believing more tests mean more protection. We trust the system. We want reassurance. We want control over our health. But here's the truth very few people hear. After 70, some of the most common checkups can actually do more harm than good. Today, I want to take you through 5 medical tests that sound helpful, but may quietly put your quality of life at risk. We'll talk about the science, the stories of real seniors, and most importantly, the wiser alternatives you can choose. And before we dive in, I'd love to know, where are you watching from? How old are you? And have you ever had a medical test or treatment that left you wondering if it was really necessary? Share in the comments. I'll be reading and replying with personalized tips. Now, let's begin with number 5. It's a scan that looks harmless, almost routine, but it can set off a chain reaction of fear, medication, and complications you might never have expected. Number 5. Bone density scans, DEXA, when scan results trigger overtreatment. At first, it sounds like one of the safest tests you could ever do. No needles, no pain, just a quick scan that tells you how strong your bones are. For many seniors, it feels like a harmless way to check for fractures before they happen. But here's what most people are never told. Past the age of 70, almost every scan will come back looking low. And that's not always a warning sign. It's simply a reflection of the natural aging process. Just like wrinkles on our skin or silver in our hair, bones naturally become less dense over time. The trouble is, once a scan shows a lower number, fear sets in. Doctors often prescribe powerful medications called bisphosphonates. They're meant to protect the bones, but the side effects can be devastating. Some people develop painful heartburn, others even face rare complications like damage to the jawbone. Let me share a story. Rose, a 76-year-old retired piano teacher, went for her annual checkup. She had never broken a bone, never fallen, and walked every morning. Her doctor suggested a DEXA scan. The results showed osteopenia, a mild reduction in bone density that isn't even osteoporosis. Still, she was started on medication. Within months, Rose developed severe reflux and jaw pain. She stopped playing piano because of the discomfort. When we finally reviewed her case, the solution wasn't more pills, it was lifestyle. We supported her with vitamin D, added weight-bearing exercises using simple resistance bands, and encouraged a calcium-rich diet with foods like sardines, leafy greens, and yogurt. A year later, Rose was back on stage, performing with stronger legs, better balance, and no fractures at all. The lesson here is simple. Don't let a number on a screen scare you into treatment you may not need. For many people over 70, the safer, smarter path is to focus on lifestyle, strength training, balance practice, good nutrition, and treating any vitamin D deficiency. Studies even show these changes can reduce fracture risk by more than 20%, far more than some medications ever achieve. So, before you rush into medication after a scan, pause and ask, what will this treatment really change for me? Sometimes, the best protection comes not from a prescription, but from how you move, eat, and live each day. But bone scans aren't the only test that can quietly create fear and unnecessary treatments. The next one goes even deeper, into the brain, and for many seniors, it can open the door to anxiety, invasive procedures, and even surgery that may not help at all. Let's talk about checkup number 4, the brain MRI. Number 4, brain MRIs for mild memory concerns, normal aging versus overreaction. When we begin to forget names, misplace our keys, or lose our train of thought, it's natural to feel a little afraid. For many seniors, that fear quickly turns into a question. Is this dementia? Am I developing Alzheimer's? Doctors, wanting to be thorough, often order a brain MRI, a scan that gives a detailed picture of the brain structure. But here's the truth that isn't often explained. In people over 70, most MRIs show changes that are completely normal. Small spots of white matter, slight shrinkage. These are simply signs of aging, not disease. Yet once those spots are seen, they can trigger a wave of worry. Reports come back with words like abnormality or lesion, and suddenly, a person who was only mildly forgetful is convinced something serious is wrong. Let me share George's story. He was 74, a retired engineer, sharp as ever, but he noticed he was forgetting names more often and sometimes misplaced his keys. His doctor ordered an MRI. The scan showed white matter changes, common at his age. George panicked. He stopped driving, stopped attending church, and spent weeks consumed by the idea that he had dementia. When we met, we gave him a simple cognitive test, the kind you can do with paper and pencil. His results were well within the normal range for his age. We explained that his MRI findings were just part of getting older, not a sign of disease. Instead, we focused on lifestyle, better sleep, staying hydrated, daily walks, and brain exercises like puzzles and memory games. Within a few months, George's confidence returned, and so did his joy in everyday life. The lesson here is this: scans show structure, not function. They can't always tell us how well the mind is working. For mild memory concerns, a basic cognitive screening and a check for reversible causes, things like vitamin B12 deficiency, thyroid issues, or even poor sleep, are often far more helpful than an MRI. The scan should be reserved for red flags, sudden confusion, seizures, personality changes, or rapid decline. So, before agreeing to a brain MRI for simple forgetfulness, pause and ask, what exactly are we looking for, and what would we do if we find it? Because sometimes reassurance doesn't come from a high-tech image, it comes from understanding what's normal, making small changes to our lifestyle, and remembering that aging doesn't always mean illness. Now, if the brain scan raised fears, the next test can raise stakes even higher, this time involving the heart. It's one of the most common tests prescribed to older adults, yet it often leads to invasive procedures and risks that far outweigh the benefits. Let's move on to number 3, the cardiac stress test. Number 3, cardiac stress tests, false positives, invasive cascades, and safer alternatives. If you've ever felt a little more tired on a walk or noticed your chest tighten after a long day, it's natural to wonder, is it my heart? Many doctors, wanting to be cautious, order a stress test, the kind where you walk on a treadmill while hooked up to monitors, or sometimes receive medication that makes the heart beat faster. The idea is to see whether blocked arteries are hiding in the background. But here's the problem: after 70, stress tests often mislead. The heart's electrical signals naturally change with age. Many seniors already have other conditions, like high blood pressure or stiff arteries, that can make the test look abnormal even when the heart is fine. In fact, studies show the false positive rate can be as high as 40%. That means nearly half the time, the test suggests trouble when there isn't any. And once the test looks suspicious, the cascade begins. Angiograms, stents, even bypass surgeries, all procedures that carry real risks, from bleeding and kidney injury to weeks of recovery. Take Raymond, for example. He was 75, a retired postman who loved his daily walks. One day, he mentioned feeling a little more tired on hills. His doctor ordered a stress test. The results were unclear, so Raymond was sent for an angiogram. A small narrowing was spotted and a stent was placed. That night, he developed kidney problems from the contrast dye and spent nearly a week in the hospital. And the sad part? His fatigue never improved because the real cause wasn't his heart at all. He simply needed better hydration and rest between meals. The lesson is this: not every tired breath is a sign of heart disease, and not every suspicious test result means you need surgery. For many older adults without clear symptoms, things like chest pain during exertion, sudden breathlessness, or sharp drops in energy, a stress test may do more harm than good. Safer first steps include a resting ECG, which checks the heart's rhythm while you sit still, or a coronary calcium scan, a low radiation test that can show whether dangerous plaque is truly building up. So if your doctor suggests a stress test, ask, what are we hoping to learn, and how will this change my treatment? Sometimes the right choice isn't more testing, it's better listening to your body, pacing your day, and caring for your heart with simple lifestyle habits. And speaking of invasive tests, the next one may surprise you. It's a procedure many people over 70 have had, sometimes more than once, but after a certain age, its risks can far outweigh its benefits. Let's talk about number 2, colonoscopy. Number 2, colonoscopy in older adults, balancing cancer prevention and procedural risk. For decades, colonoscopy has been hailed as the gold standard for preventing colon cancer. It uses a tiny camera to look inside the colon, removing polyps before they can turn dangerous. For middle-aged adults, it's often life-saving. But once you pass 70, and especially after 75, the picture changes. Here's why. The preparation is tough. Strong laxatives can cause dehydration, dizziness, even kidney problems. The sedation used during the procedure adds risks of confusion or memory issues in older adults, and the scope itself, though routine, carries the chance of bleeding or even tearing the bowel wall. The benefits also shrink with age. Studies tracking thousands of seniors have found that in people over 75, only a tiny fraction are saved from colon cancer, while many more suffer serious complications. Let me tell you about Dana. She was 73, a grandmother who ran a small bakery with her daughter. She felt well, had no symptoms, and had already had 2 clear colonoscopies in the past, but her new doctor urged her to repeat the test. During the procedure, a small polyp was removed. That evening, Dana developed severe abdominal pain and collapsed. At the hospital, they discovered a bowel perforation. She spent 9 days in recovery, lost weight, and never quite regained her former energy. The lesson here is this: past a certain age, routine colonoscopy is often more risk than reward, especially if you've had clear results before and don't have new symptoms. Guidelines suggest that for most people, screening should stop at 75. For those in good health who still want reassurance, there are safer, simpler options, like the FIT test, a stool-based test you can do at home without sedation or invasive prep. So if you're over 70 and your doctor recommends a colonoscopy, pause and ask, what will this test really add, given my history? Are there less risky alternatives? Because sometimes prevention doesn't mean doing more, it means choosing wisely. And that brings us to the number 1 checkup on our list, one that's marketed as the ultimate safeguard, but in reality, it exposes your entire body to hidden dangers. Let's talk about full-body CT scans. Number 1, annual full-body CT scans, overdiagnosis, radiation harm, and the high cost of looking for everything. It sounds futuristic, almost like the ultimate safety net, a single scan that looks through every part of your body, promising to catch cancer or hidden disease before it's too late. Many private clinics even market it as part of an executive health package. On the surface, it feels reassuring, but here's the truth. For older adults, especially over 70, these scans may cause more harm than good. A full-body CT exposes you to a very high dose of radiation, the equivalent of hundreds of chest x-rays in a single sitting, and that radiation doesn't just disappear, it lingers in your cells, raising the risk of developing cancer down the road. Some studies now suggest that up to 1 in 20 cancers could be linked to unnecessary medical imaging. That means a scan meant to prevent disease could actually cause it. The second problem is overdiagnosis. CT scans are so sensitive that they often find harmless little incidentalomas, tiny nodules, calcifications, or cysts that are part of normal aging. But once they're spotted, alarm bells ring, more scans are ordered, biopsies are scheduled, surgeries are recommended, and the patient who felt fine to begin with is suddenly swept into a medical whirlwind. Let me share Marcus's story. He was 80, an active martial arts instructor for seniors. He felt fantastic, strong, flexible, full of life. During a checkup at a private clinic, he agreed to a full-body CT just to be safe. The scan found a tiny lung nodule only 3 millimeters wide. His doctor referred him to oncology. Soon he had a PET scan, then a needle biopsy. The result? Completely benign, but the biopsy collapsed part of his lung. He spent weeks in the hospital and months regaining his strength, all for something that never needed treatment. The lesson here is powerful. More information isn't always better. Sometimes searching for every possible problem creates new ones, problems more dangerous than the disease you feared. For most healthy older adults, there's no evidence that routine full-body CT saves lives. The smarter choice is targeted imaging only when there are real symptoms, unexplained weight loss, persistent pain, or bleeding. Otherwise, listening to your body and sticking with regular, sensible checkups is far safer than chasing shadows on a scan. So before saying yes to a full-body CT, pause and ask, what exactly are we hoping to find, and how would that change my care? Because peace of mind doesn't come from scanning every inch of your body. It comes from living well, staying active, and knowing which tests truly matter. And that brings us to the end of our list. 5 common checkups that may look protective on the surface, but after 70 can quietly harm more than they help. Modern medicine is powerful, but sometimes less really is more. So there you have it. 5 health checkups that may look reassuring on the outside, but after 70 can quietly cause more harm than good. Let's quickly recap. Number 5, bone density scans. Don't let a low number push you into unnecessary medication. Lifestyle can protect your bones far better. Number 4, brain MRIs for mild memory loss. Normal age-related changes often look alarming on scans, but don't always mean disease. Number 3, cardiac stress tests. False positives can lead to risky procedures when a simple ECG or calcium score might be safer. Number 2, colonoscopy. After 70 and especially 75, the risks can outweigh the benefits unless there are real warning signs. And number 1, full-body CT scans, marketed as protection, but often bring radiation, overdiagnosis, and unnecessary fear. The message here is simple but powerful. Sometimes less really is more. True prevention doesn't always come from more machines or more scans. It comes from the way you live each day, staying active, eating well, sleeping deeply, and asking thoughtful questions before agreeing to any test. Now, I'd love to hear from you. Have you or someone you love ever had a medical test that led to unnecessary worry or treatment? What happened and what did you learn from it? Share your experience in the comments. I'll be reading every single one and responding with personalized advice. If you found this video helpful, please give it a like, subscribe, and share it with a friend or family member who might need to hear this message. Together, we can create a community where seniors are empowered, informed, and able to live their healthiest years with confidence. Thank you so much for watching, and remember, your health is too precious to waste on fear. Choose wisely, live fully, and I'll see you in the next video.